We are here for our next installment of leadership training, and we're so happy to have you with us. And I'm Mandy, and it's great to see you all. We've got other staff on. We've got Karen, and we've got Lisa and Tammy, and happy to have you all here. So today's training is going to focus on enhanced communication skills as well as hypertrophic cardiomyopathy. And I'll share the breakdown of that in just a few minutes. But before we get started on that, just remind you if you could remain in listen only mode. This is a meeting, so there will be some free-flowing conversation, but when our speakers are talking, if you could remain on mute, that would be great. We won't be able, as always, to answer any questions related to your specific condition, and just encourage you to talk to your doctor about that after if you have any specific condition questions. You won't have to use the Q&A box, but you will be able to use the chat box or just come off mute. And this training will be recorded and available on our website afterwards. So you can share with your fellow leaders and visitors. And we are thrilled to introduce Tara, who is a leadership facilitator, association executive, and organizational strategist. She serves as president and CEO of the Radio, Television, Digital News Association and the RTDNA Foundation. And she's also the founder and CEO of Gray Rails Consulting. She's facilitated leadership and strategic planning sessions for thousands of professionals, helping organizations like ours strengthen their governance, navigate change, and build sustainable futures. She's recognized nationally for her expertise in leadership development, board culture, and organizational, I can't read that last line, I'm sorry, because it's hidden by my chat box, but organizational planning and structure, which is why we're so lucky to have her here today talking to all of us. So Tara's going to talk for the first hour about communication, and then we're going to be joined for the second half of our presentation by Christian Nicolosi. Christian is with BMS, and she's a senior medical science liaison in cardiovascular disease at BMS. She has more than 9 years of experience as a clinical pharmacist in cardiology and critical care, and her work centers on scientific education and collaborative exchange in the HCM space and emerging cardiovascular therapies. So we're really lucky to have both of these women on here presenting. As I said, Tara will present for the first hour. We'll take a 2 or 5 minute bio break, and then Christian's going to come on for the last hour, 45 minutes. So join us in welcoming them and in thanking BMS because with their support, we are able to bring you this free training. And now I'm going to stop share. And I'm going to let Tara take it from here.
Hi, friends. How is everyone today? I see some head nodding. We're good. I see thumbs up. Fabulous. I was telling the wonderful staff that I'm just outside of Indianapolis, and we finally have some sunshine here today. We've had rain for a little while, so I am feeling a little less gloomy around here, which is fabulous. I'm going to go ahead and share my screen and get us going here. Today, we are going to focus on communication. And everybody good now? We're going to focus on communication and the art of how we show up and interact with one another, what that means, how we can do it more effectively, and how we do that in interpersonal relationships, and kind of a little bit of the reasoning behind how we show up in different settings and in different ways. So I'll just ask, and I can see some of you, but I'm going to change it because I would love to see all of you. How many of you think you are a fabulous listener? I see a couple chuckles and then a couple hands up. So I think everybody has the potential to be a fabulous listener. And so ideally, that's what we will get you to today. A few more tips and tricks in terms of when you're showing up and you're having important conversations, how you can do that more effectively. And Mandy, I agree. I try. I think we all do. And that's really where we can start. So, thanks for introducing me. I have lots of traits, but one of them is continually trying to improve my communication. And I'm not sure how many of you have a partner or a spouse or a best friend or kids, but we all have these interpersonal relationships that we manage daily. And one of my favorite listening stories is that I have started to do this thing with my husband, which is if he asks me something that I've told him already, which I'm sure none of you could ever imagining happening in a relationship, I will just say it's episode 3, right? Like this is the third time we've talked about this. We're currently on episode 7 on our mulch and landscaping conversation, and so I think we continue to have some of these instances where it's very clear that there's some disconnect in how we communicate with one another. And what does that look like? So I'll just ask, and you can pop in the chat with an example or a yes, or raise your hand. If you've ever nodded along in a conversation while you were also mentally composing your grocery list or thinking about what was on your calendar tomorrow or next week, and you gave some courtesy nods and a few, yep, yes, I see it. It happens to me all the time. What about somebody asking you a follow-up question and you just answered it 5 minutes ago? This happens a lot, I think, when people are scrolling on their phones and people are talking to them, right? We're reading, we're engaged, we're doing other things. If you've ever wanted to reassure someone that they were going to be okay before they finished telling you what was wrong, that happened to anybody? I've done this with my kids. My oldest just graduated, and so lots of conversations, tough conversations about what she's going to do moving forward with her life. And I wanted to tell her it's going to be okay and she's going to figure it out, right? So I think all of these examples are influencing and addressing and good examples of what happens when we communicate effectively, what happens when we don't communicate effectively, and what that looks like. So communication, listening specifically, is really, really important, especially in the work that you all do. So you are bridging the gap. You are showing up as a vital point of contact for folks. You are offering empathy. It's rooted in lived experience and understanding, right? And so having better listening skills, that's a huge reason of why it's so important. The complexity of connection also makes it really important, which is having shared history, shared experiences. That requires some careful navigation of emotions, of feelings, of understanding. And so creating those deep connections where you're able to provide support and also listening to the way that folks feel is critical. The next one is a core objective. And so in the work that you all do, understanding that it's not just a simple conversation about landscaping or gutter cleaning or the grocery list, right? It is how do we transition our listening style from conversationalist, where we're talking about things that are sometimes very low stakes, checking the boxes, task lists, those types of things, into being a better witness for those that you engage with and work with. And then lastly, the power of presence. So understanding what active listening does, creating validation for folks instead of kind of dominating the conversation, but how do we better walk alongside folks and support them in the things that they're going through? And this shows up in your work, but it also shows up in personal life. So active listening and understanding kind of the art of how we show up is really important. When we look at the numbers, 96% of people think that they are good listeners. So the fact that we had a lot of hands raised at the beginning doesn't surprise me. But what we know statistically is that people listen with about 25% efficacy. So we think we're fabulous. We are somewhere in the not fabulous, but we're working on it, right? We're trying. And so recognizing that this is a skill we build from our childhood all the way up through adulthood, and everybody has the ability to improve it. I want to talk just a little bit about what listening actually is and kind of the differences and how we determine that when we sit down with folks. So listening at its core is making meaning from sound. We have words, we use language, all of those things are really important. But at the end of the day, what we need to do is determine what the meaning of those sounds are. So for example, if we were to sit in a room and you started to hear people interact with one another, there's people eating. Anybody ever sat in a big conference room like this, a cafeteria? There's stuff going on. Sometimes restaurants can be so loud. And you hear all of these conversations, and our brain struggles to discern the differences between what we're supposed to be listening. But if this noise kept going and I said, Jeffrey, Robert, you guys would have perked up because you have a recognition that I'm speaking directly to you. And so this is the recognition aspect of listening. And it's one of the ways that we discern and try to make meaning from sound. The other thing that happens is differencing. And so if you listen to this noise, this pink noise, this beautiful ocean that I would love to be by, if I played this for 4 or 5 or 6 minutes, eventually you would stop hearing it because your brain starts to differentiate sounds that sound the same. So this would fade into the background and you would start to be able to hear different sounds on top of it. One of the other ways that we move through sound are filters. And so we have all of these pieces that help us understand what we're listening to in order to make meaning of sound. So we have language, obviously. We have culture. We have beliefs. We have attitudes, intentions, values, expectations. All of those things are how we filter information that is just sound, and we process it in order to be able to listen to it. If you think about where people are from, you will notice that some folks have different words for things. So for example, if I asked you to put in the chat, when you go to the store and you're pushing the thing that you put your groceries in, what would you call it? And you can unmute and share it if you'd like. Cart, shopping cart.
Shopping cart.
Shopping cart. Anybody call it a buggy?
Buggy, yeah.
Cart.
Basket.
Yes, a basket. And if I asked you if you went to a particular restaurant that takes lots of meats and cheeses and they put them on 2 pieces of bread and you can get them in 6 foot or 12 foot and you eat them and they're a particular type of sandwich, what would you call that?
Po' boy. Subs.
Po' boy. Subs.
Sandwich. A sandwich.
Just a sandwich. Anybody call it a hoagie? No? Okay. So all of those have context for us, and they are filters in how we start to make meaning of sound. Where we are from often differentiates some of those filters. The culture also differentiates some of those filters. And your values also affect those filters because you are listening for key things that you agree or disagree with, and you will interpret those sounds as words in different ways. So when we think about it, and we know that 25% efficacy in how we listen isn't the 96% that we'd love to be at. So we're trying, but what are we really doing in instances where this is difficult? We are oftentimes rehearsing a response. So I'm sure this is one everybody is familiar with when you are listening to answer or listening to respond instead of processing the information. This is one that starts to develop and be worked through essentially as we're younger, because we think in the ways that we communicate. And you think back to school, right? When the teacher asked a question, you wanted to be the first one to answer in some instances, or you were sitting in the back and didn't want to answer at all, right? Depending on what kind of a student you were. But in any case, you are quickly trying to answer the question. And so that's a learned behavior, and it's also one that just exists with us. And so that's one of the challenges that we're working through. We're also comparing personal experience. Anyone ever enter into a conversation with someone that no matter what you said, they had an experience that was like it or better than it? So yes, I saw Carl. So yes, so I went on this trip. Oh, I went on this other trip. And now you're not talking about your trip at all because they've hijacked the conversation, right? And so we do see it as a way to create shared connection, but we also have the ability to overuse this. And we kind of pull people's experiences and replace them with our own in some cases. Attempting to fix the problem. And so this is moving prematurely to the solution mode before you fully understand what's happening. So this is that question I asked at the beginning, which is, do we feel like we tell people that it's going to be okay, everything will be fine sometimes before we understand the magnitude of the problem? This is also one that you may have heard people reference, sometimes when I engage in conversation, and this is a good tip that I try to follow, I will ask, do you want me to help you fix it, or do you just want me to listen? Because we don't all have the same goals when we're sharing challenges, right? And then one of the fourth things that we sometimes do when we struggle with communication is we fast forward to an assumed conclusion. And so there's lots and lots of funny videos out there, specifically in workplace settings, where people are finishing the sentences before somebody is done. They've created an assumed problem. They've sometimes put their foot in their mouth because we predict the behavior of others just inherently in the way we interact with one another. And so these four things are things that we struggle with a bit when we try to do communication. And oftentimes it's difficult to realize them because communicating is something we're doing every single day, day in and day out with different groups of people. Personal, professional, volunteer opportunities, all of those things are areas where we're communicating. And so these are places where we sometimes see some oopsies and some of that gap between the 25% efficacy and the 96% of where we think we are. The other thing here is that we talk and we share information and we listen at about, and when we speak at about 125 to 150 words per minute. But our brains can process listening at up to 450 words per minute. That's a pretty big gap. And so if we are working to fill it, that gap is where we can stick that grocery list while somebody else is talking to us, or the calendar items for the next day. We process much faster than people often interact with one another. And so our brains feel like there's some extra space in here and we could do something else with it. I love this quote because I think it's so impactful and so important. Hearing is listening to what is said. Listening is hearing what isn't said. And I think in all of the scenarios where we think about actually listening and processing information that people are sharing with us, we will find that this is true. We want to understand what is not being said and often what we're not asking. So there's so many nuances about communicating effectively and the art of listening that don't show up in the words or the sound that we are making meaning of. When we think about the principles of active listening, there are several of them. And I want to kind of walk through them, and then we're going to talk about them, and then we're going to put some of this practice into action in some breakout groups to see what that looks like. So all of listening, and especially in the work that you all do, should be rooted in this empathetic style of engagement. We listen better when we understand and appreciate the challenges, the successes, the emotions, all of the pieces that people are communicating with us. And so we want to track the underneath. We want to listen, again, kind of that listening is hearing what isn't said. What is beyond the literal words that are coming out of people's mouth? How do we understand and appreciate those? We also want to resist the redirect. So this is kind of back to that, your vacation's nice, but let's talk about my vacation, and let's change the narrative to what I want to do. We also want to follow and not lead. And so if we are in an active listening engagement, we want to allow the other person to set the pace, to set the speed, to follow their perspective in those conversations. So a little bit more specific, in terms of tracking the underneath, this is kind of like the iceberg analogy, which is that the core meaning lies submerged in that emotional landscape. And so if you think about how people communicate, there's so many ways. The things they say, the way their body moves, the way they stand, right? We're communicating in all of those ways. Oftentimes, the core meaning of what we're saying isn't actually what we see or sometimes what we even say. So you want to move past that piece. You want to move past that general data to identify the underlying tones. So listening beyond the content. Sarcasm doesn't often mean what we actually say, right? We want to listen for hesitations, unexpressed needs, all of those elements of listening actively that aren't just processing the words that you're saying to me. And then regularly asking yourself throughout this, what is this person carrying right now? What are they holding? What do they need to share with us? And then you're validating this emotion to build that trust, to continue to uncover that root of the core thing they're trying to share with you. When we talk about resisting the redirect, we want to resist that immediate urge to say, I know how you feel. We want to resist the urge to pivot the conversation to your own personal stories. If you hold back your own experience a little bit, it allows the other person to feel truly heard and validated. Sharing connected experiences is so important, but not at the cost of cutting off someone else's experience. Your personal experience is such a powerful tool for building credibility, trust, understanding, and it's most effective when it's shared at the right moment. And that's only after the person you're communicating with feels understood, feels heard, feels listened to. And so pause, listen, let their story heard before sharing your own. So that's strategic sharing. And then, of course, the golden rule, right? Think about how you would want to engage in conversations and what that looks like. Showing up as an active listener in ways that you would like to be listened to. And then lastly, follow, don't lead. So sometimes we feel the need as humans to fill that awkward silence. Anyone ever been in a room where there's a conversation and it's just a lull and nobody says anything and everybody starts to feel that uncomfortable pressure to either talk about the weather or the sports team or something else that could fill that silence? Silence is necessary for people, many, many people, most people, to process and reflect on their experiences. And so if you're asking, an open-ended question and you're not giving enough time for it to be fully processed and answered, we've kind of taken the lead and moved the conversation in a different direction. Focus on that one question. That will allow them to take the time and space to feel heard. And then last, avoid leading. So don't offer a menu of feelings, right? When someone is speaking and engaging, allowing them to process and use language to describe their own feelings is really important because they can then define their own emotional experience. And again, all of these pieces aren't no's. They are right time. They are right process. Because at the end of the day, we want to make sure that the folks we're listening to and engaging with feel like we've given them time to share and process their feelings, their understanding of a situation, and what that looks like. So I will ask then I will kick you into some breakout rooms really quick, and I would love for you to share just briefly, maybe 1 to 2 minutes for each of you, about a time that you felt heard or a time that you didn't feel heard. And so these could be incredibly low lift conversations like my example about the landscaping or the gutters or numerous accounts of conversation with my children. Or it could be an experience that you've had as a volunteer that's meaningful, where you felt like someone heard you, or your own personal journey. So I'll give you maybe 1 to 2 minutes, per person. We want to make sure that we get through everybody. There'll be about 4 of you, 5 of you in the breakout room. So I'll check in via the chat broadcast to groups, but I'll go ahead and bump you out there now. So you should be able to click join the breakout room. And you're going to be talking either about a conversation where you felt heard or a time where you did not. And the rooms are open. Okay. We just got the last group back in the door. I would love to hear from some of you if anybody feels comfortable sharing. What were some of the conversations that you shared with your group? Maybe just one or two. Want to share with the full crowd here? Feel free to unmute.
I'll start. I'm happy to start. I had a great conversation in our little group, and Amy shared with me that her boss, when she has a review or has a meeting or has time with him, he basically doesn't take any calls, closes his computer, puts his phone off, and just really is focused on her. And she just adores him for that. And then I shared that at a time today, actually, when I felt like I wasn't listened to, I was walking my dog early this morning and we came across this poisonous snake. And I told our property managers about it, thinking they could send a note to everyone. I mean, I live in North Florida. There are snakes everywhere. But I just kind of wanted a heads up to all the dog walkers and people walking on this path. Heads up, like people are seeing snakes, so heads up. But nobody ever did anything. Nobody ever sent a note, so I didn't feel heard.
Yeah. There is research about when you sit down to have a meal with someone or a conversation with someone, and if you put your cell phone face up on the table, the way that it makes people feel as if, even if it's still on the table and it's face down, just the vast difference between how they feel like you are ready and capable to engage with them. John, go ahead.
We talked a lot about how the hospitals we deal with communicate with us or don't communicate with us, and the different levels of information we get about the people we visit.
Yeah, absolutely. Those filters for others and how we process that is wild. And when you have similar situations for conversations and they are all providing different pieces of information to you, it makes it hard to sometimes discern what is important or what you're missing, right? Anybody have another example that they want to share? We'll take one more. Oh, Ken, I see your hand.
Yes, we talked about the difference between Zoom meetings and in-person meetings, and in some of the groups, Zoom just doesn't work for Mended Hearts type groups, or in one of the book clubs that I'm in, it just doesn't work. And then in a different book club with the same age group, Zoom meeting works and in-person doesn't. And there's a big difference. And I'm not sure how many other groups have the same problem. Have you tried Zoom meetings, and do people listen? Do they join them?
It's a good question.
Yeah,
I think for all of the downsides of the pandemic, right, we were able to stay connected in some way. But I don't know that that always replaces the in-person. But you're right, different groups, different engagement styles. I facilitate a lot virtually for folks. And one of the questions I always ask, the staff that I'm working with is, how much do your people engage on Zoom calls? Do they go into breakout rooms and have conversations? That's back to those filters, which the culture of the group of people that you have, right? Is it highly engaged in a virtual setting? Is it low engagement in a virtual setting? It can vary wildly, and there's no like rhyme or reason for when it sticks and it works and when it doesn't.
Tara, can you
Yeah.
hear me? No. Oh, okay. Ken, I was thinking about what you were saying. Our use of Zoom is usually in our team chapter meetings. It's like if somebody's not feeling well, or usually there's somebody in our group that's not feeling well, but so they still are connected in some way. But the chapter meetings tend to be more about being together, because when you're sitting together and you go around the room and say, how are things going for you, Ken, and what's been people don't know you, Ken. Let's share something. Then you find out somebody else in the room had a triple bypass like you did, and you're all of a sudden your best buddy. So I'm not sure if that necessarily works with Zoom, for that kind of interaction. It seems to me the person for certain things is better. I don't know if you feel that way, Ken, but or anybody.
Yeah.
Yeah,
Go ahead, Ken.
a lot of I enjoyed the in-person meetings quite a bit, but I've managed to adjust to the Zoom meetings.
Yeah.
Yes.
If I could jump in, since COVID, all our meetings have been hybrid where we do in person and Zoom. And
Yeah.
particularly in the winter, I'm in the Chicago area, so particularly in the winter, people don't like coming out. So we get at least half the attendees are on Zoom. So I just make an effort as the moderator to get them more involved. Like we'll ask them at the beginning before the speakers get there how they're doing, or if there's anyone new, we'll ask them to introduce themselves. And when we do have the speakers, if someone online has had something the speaker is talking about, I'll ask them if their experiences are the same. Or it just takes a lot more work to keep them involved, and I miss the personal interaction. But now that the weather's better here, more people seem to be coming in person. So I kind of figured the Zoom people are like planting seeds for future meetings when I'll actually meet them in person. Yeah. And I had
That's a
talked to
really good
people.
point.
Yeah, I had talked to people at headquarters when it started because I was a little discouraged, and they said, "Well, if they're coming, they're coming. So, take them, take them."
So
Yeah.
have a number of y'all or most of y'all have meetings in the hospitals or hospitals? Ours sort of shut down in-person meetings for, I think the lawyers got involved, and it's almost like the hospital still has COVID.
Yeah.
That's too bad.
Those are in the hospital.
Well, we have
Ours
a
are in the
set.
hospital.
I'm sorry.
We do all of ours in the hospital.
Yeah, that's too.
Our
I think
satellite
Yeah, that's
has
true.
in person in the hospital.
I think the setting of meetings also matters. And I'm glad you brought up the intentionality behind that, John, right? Because when you're communicating with folks virtually, what we know is that it's a little bit more stressful on the brain because part of how we interpret the information that others share with us is by watching their body language. And when you think about how you're processing the body language from people when they're in a little tiny box, right? It's maybe the top third of their body. So oftentimes you're missing their hands, which when you think about how you talk to people, you see hands a lot. We use our hands. You also can't see their stance or the way they're sitting sometimes. And so it really is more challenging for people to kind of communicate effectively because it drains the body more because our brain is consistently, if you're driving around looking for a cell tower, sometimes your phone is always searching. That's kind of what happens when we are on Zoom meetings. Our brains are always searching to understand the body language of folks that we're talking to. So I think all of those things are such important nuances about how we talk to one another. I want to take us just for a little bit, and then I'm going to give us one more quick time to pop out with one another. One of the bigger challenges of communicating happens when we have care behind our communication. When you think about how you interact with a stranger, or for example, if you are trying to get directions from someone you met at the gas station, that is a low stakes communication between one another. When you have care for someone, whether it's because it's a personal connection and you care for them, or because you have a shared experience and deep empathy for what they're going through, communication actually, it can be a little bit more difficult because of all of the things that are complicated in that. And so when you have high empathy for somebody, it is a catalyst for that conversation. So it becomes a little bit harder to kind of pause on that fixing drive, right? When you think about it, if you think about your kids, we often want to fix them because we care so deeply. We want to help fix their problems. I know I wanted to fix my kids' problems as they were growing up. And so we want to fix a little bit more when we care deeply and we have that high level of empathy. The other thing that happens here is that, in that kind of fixing thing, we are just hardwired to want to find some immediate solutions because we want to alleviate that discomfort for people because we have a high level of care for them. The survivor's dilemma is when we have a shared experience and we want to provide reassurance around kind of that shared experience, which is really, really important to communication. It's really, really important for people to understand. But again, this is one of those things that if it's done at the wrong time, if we've cut off someone else's shared experience, it can actually be a drawback to the way that we communicate with one another. And so it does create a bridge to hope. It creates shared understanding, but it does create a need to have that careful management of when those conversations and pieces take place. So when reassurance can backfire. So this is one of those things when we say, it's going to be fine, or let me help you sort this out, or all of those things. Sometimes when we say that, it's interpreted as a dismissal. So the running joke of the husband and his wife or partners where somebody's like, I said it's fine, and that was the wrong thing to say, right? Because you can sometimes interpret that it's fine as or it's going to be fine as I really shouldn't be so worked up about this, or I shouldn't be emotional about this. And so sometimes when you say things out of trying to provide comfort, it can make others feel as though you're dismissing their feelings or signaling that you're uncomfortable with the emotions that people are putting off, or that you just, it's going to be fine, right? And this is all back to those tones and those filters and those values and those cultures. The conversation killer. So sometimes when we offer that premature reassurance, right? Like if someone is sharing an important story, or it ends up being a lengthy story, and we say, oh, yeah, I understand, but it's going to be okay. We may do that from a place of empathy, but what they have sometimes felt is that they didn't have the ability to share their whole story or finish what would build a really emotional connection. And so the goal then is to just practice holding that space, understanding that sometimes when we care deeply and we want to tell people that we're there for them and we understand, that sometimes it may cut off the experience and not be able to continue to build that emotional bridge that allows for people to process and validate feelings and all of those things that are really important when we think about shared communication. And so one of the easiest ways to think about this is having some language that follows instead of leads. And so when we have the desire to say some of those things, this is a good one. It sounds like you're carrying a lot right now because you are validating how they feel, you are sharing that you understand it, and you're allowing to have space for those things. Tell me more. This is a great way to fill what is sometimes an awkward silence without diverting the conversation. Just truly tell me more. Not only do you then have the ability to fill that silence if it makes you uncomfortable, but it also makes people feel like you really have an interest in understanding what they're trying to communicate with you. What's been the hardest part? This is actively asking people to share a deep reflection on what their challenge is. Right? And it is not the nuance of this is happening to me, but this was a difficult piece of this, and sometimes allows people to focus on communicating in smaller bits, which for some folks makes them more comfortable. Sometimes when we think about the deep, vast experience of what people are going through, especially those that you engage with and yourselves, thinking about taking it in smaller chunks is sometimes easier for people to communicate about. And so creating that shared language that follows or instead of leads, and allowing the person you're communicating with to kind of lead the conversation. So all of these statements function as keys to opening doors because you're following, not leading. I'm going to pop you right back out to your breakouts, but just really quickly, if one person in your group would share just a story. It can be an experience that they had this morning over coffee. It could be Karen's experience with a snake, right? It doesn't have to be a high stakes or emotional story, but I would love everybody who's listening in that group to just think about some of the things that we've said. And so, for example, if Karen was telling her snake story and I was also from Florida, I might have a really strong urge to be like, oh, you know what, Karen, I just saw a snake last week and they're everywhere, right? And so all I just want everybody to do is to listen in that 2 to 3 minute story and think about areas where you might be making some conscious decisions that change the way that you have communicated before. Does that make sense? Okay, fabulous. So I'm going to just push you back out into your breakout room. Just a reminder, go ahead and click that join. This one will be shorter, just about 4 minutes, 4 or 5 minutes. One person share the story, everybody else engage in that conversation using some of the tricks we talked about today. Okay. See everybody filtering back in. How was that? Was it hard to resist some things that you may have done in conversation? Did you get stuck? Maybe just 1 or 2 really quick reflections on how that exercise was, or you can put them in the chat too.
I thought it was a good exercise, and those key phrases really help a lot. Like, it sounds like you're carrying a lot right now. And then remind one phrase I was reminded of was, when you kind of repeat back what they said, like you just say, I heard you say, and you're not trying to fix them or trying to tell them, everything's going to be great when you really don't know, and you just a witness, just being a witness.
Absolutely.
Well, for me, group 5 is really becoming a tight little group. We're a bunch of gentlemen. We got our age up there, but we're having a wonderful time just chatting.
I love that. You guys are communicating effectively. That's awesome. So I think the really important thing, and I'm glad somebody put this in the chat at the very beginning, is that the goal here is to be present over perfect, right? Our communication styles is an evolution. The way we learn to communicate, the way we do it more effectively, with more empathy, with different phrasing, understanding all of those things are a learning journey. And so the focus really is on being present over perfect. There is no perfect communication style. There's no perfect communication method, right? We're all just learning. And so recognizing that piece is really important. I want to leave you with kind of 3 things that I think are keys to help learning to love listening that we can kind of train ourselves on each day. So silence every day, 3 minutes. It sounds kind of strange, but sitting in silence without background noise, without people talking to us, without anything else will allow us to process and feel more comfortable in silence. It will also help our brains try to differentiate, right? Silence from sound, how we differentiate meaning. So spending a little bit of time in silence every day. Find the hidden choir. So listening for the mundane in some of the other sounds that you hear, making meaning of those sounds, appreciating sounds, not just conversation or words, really, really important. And so anybody ever stand outside and listen to like the frogs or the crickets in a very quiet space in the country, appreciating all of those beautiful sounds that are in the space. And then listening to the channels. So trying to kind of differentiate when we're in places like, what is this channel of information? What is that channel of information? You can do it when you're in a restaurant. Try to kind of separate out and train your brain to learn to filter those pieces and parts. But at the end of the day, listening is really just about showing up with care and understanding and a goal to have better connections with other humans at its most simplest form. So I am hopeful that some of these tips and tricks and exercises were able to help you today in understanding the art of showing up and how we better communicate and understand one another. So I wish you all good listening ahead. Thank you so much for spending an hour with me. Please take care.
Thank you. Great. That's great.
Yeah, that was great. Thank you.
Thank you.
Yes,
Thank
thank you.
All.
Thank you.
Kara, that was excellent. Thank you so much. Such valuable information for our leaders, our visitors in the hospitals and in the communities. And you just gave us some very thoughtful, I think, reminders that we all need to keep top of mind. So thank you so much. To all of our leaders who are on, we ask it, got a short bio break. We've got a very exciting session coming up in hypertrophic cardiomyopathy. This is a condition that, people are getting diagnosed with more and more for the last 5 to 10 years and beyond. It's been underdiagnosed, misdiagnosed, but with some new treatments out, we are finally starting to identify these patients, and you are probably encountering them in the hospitals in your communities. So it's important that you have an understanding of what their journey looks like and how you can, help support them. And it is something that runs through families. So for our Mend a Little Hearts groups, you probably have some members who have children living with this condition. So please come and join us back at 6:05 on the dot. Our presenters are already here. So we're going to get started right at 6:05 on the button. So, but it's 6:05. Don't want to keep people from dinner tonight. And Christian's on. So Christian, I'll let you take it from here. And thanks for being on.
There we go. Sorry, I was trying to unmute. Okay, well, good evening, everyone. Thanks so much for having me today and my colleague Juliet from Patient Advocacy. I think I was maybe introduced in the beginning, but I'm a clinical pharmacist by training. Just a little bit about myself. And I'm a medical science liaison with Bristol Myers Squibb. And what that means is my role is just to provide scientific and educational information to help support that understanding of different disease states. So that being said, today we're going to talk about hypertrophic cardiomyopathy, or you might hear me abbreviate to HCM for short. And this is a condition that many people may have heard of, but may not fully understand. And it's also something that's often under-recognized. So my goal today is just to walk you all through what HCM is, how it's diagnosed, what's happening inside of the heart, and what this means for patients and families. So before we begin, just want to give a disclosure slide and clarify the purpose of today's session. This is intended to be a very educational presentation, and I'm here to provide a general information about HCM. However, I'm not able to provide medical advice or discuss any individual treatment decisions that you might have. But if you do have questions, whether it's about your own health systems or maybe a family member's, I strongly encourage you to speak with your healthcare provider. And I'm happy to answer any general questions as we go. Feel free to interrupt the presentation with those questions within that scope. So a brief overview, just to give you a sense of what we're going to cover today. We'll start with a general overview of HCM, what it is and how common it is. And then we'll talk about how it's diagnosed and what's physically happening in the heart. And then from there, we will cover the different types of HCM, some potential complications, and the role that genetics play in this disease state. And then finally, we'll spend some time discussing what it's like to live with HCM and where and how we can find additional support and resources. So we're going to start broad, and then we'll move into like a more practical patient-centered topics. So to begin, we're going to start with the basics. Hypertrophic cardiomyopathy is a condition where the heart muscle becomes more thickened and stiff. And when this happens, it can make it harder for the heart to pump blood effectively out into the rest of the body. So one important point is that HCM might be more common than people actually realize. It is considered a rare disease. However, estimates suggest that it could potentially affect anywhere from 1 in 200 to almost 1 in 500 individuals. However, only a fraction of these individuals might actually be diagnosed. So this translates to there's probably a lot more people that may have HCM and just not know it. It's also important to know that HCM can affect people of any age, gender, background. In some cases, it can even be inherited, which is where that genetic piece lies in. One of the challenges with HCM is that symptoms can quite vary from person to person. You might have one person that's going to present with no symptoms at all, while others might experience symptoms that might come and go and then gradually worsen over time with the progression of the disease. Common symptoms could be shortness of breath, chest pain, fatigue, dizziness, or even fainting episodes. And because these symptoms can be fairly general, it's hard to attribute to other conditions, which can delay the diagnosis, just ruling out other potential disease states. So that being said, if someone is experiencing these types of symptoms, it's important to encourage them or yourself to speak to a healthcare provider so you can be properly evaluated. So building on that point, HCM can be difficult to diagnose because these symptoms might overlap with other conditions like I mentioned. For example, symptoms like shortness of breath or fatigue might sound like asthma, or anxiety or high blood pressure, or other conditions such as atrial fibrillation. And because of this overlap, you might have patients that might initially receive other diagnoses before the HCM or hypertrophic cardiomyopathy is actually identified. And so this highlights the importance of having a very thorough evaluation, especially if a patient or person has symptoms that persist and they're not getting the response to unusual typical treatment for a more common condition. How HCM is diagnosed, I'll try to explain briefly on this slide, but physicians will typically do different types of tests, which I'm sure you've heard of a few of these. So the echocardiogram, or abbreviated echo, is one of the primary tools that we use to identify HCM. And this allows doctors to visualize the heart, but it also helps measure the thickness of the heart muscle. And I'll explain that a little bit on another slide. There's other tests that include the ECG, electrocardiogram, to assess electrical activity. Cardiac MRI can also be used for additional detail. And then lastly, I mentioned genetic testing. So we can have genetic testing if there's suspicion that it might be an inherited form of the cardiomyopathy. And then lastly, in some cases, doctors might perform what's called a provocation testing. And this involves stressing the heart. So if you've ever heard of a stress test, this is where this comes into play, the stressing the heart through exercise or other maneuvers. And this helps to see if there's any obstruction that might be more apparent under those conditions. And this is important because some patients might only show signs of that obstruction if it's obstructive cardiomyopathy when the heart is working harder. And through that stress, you can find that obstruction apparent on these tests. So I know that was a lot of information up front. Just wanted to see if there's any questions. Otherwise, we'll continue on.
Christian, there was one question in the chat. I don't know if you want to answer
I'm sorry,
it now.
I missed that.
No, that's okay. Linda was asking, can you explain the difference between dilated cardiomyopathy and hypertrophic cardiomyopathy? Are you able to do that?
Dilated and hypertrophic?
Yeah, yeah.
Yeah, typically when we think of cardiomyopathy of obstructive and non-obstructive. So we have obstructive cardiomyopathy, you're going to have more of a gradient and likely more symptomatic versus non-obstructive. But I would encourage her if she does, sorry, if I can't see the chat and the person to direct you by name, to speak more with your doctor about like the specific types of dilated cardiomyopathy in that regard.
Okay, thank you.
Let's see. Okay, so now we're going to talk about the HCM heart. So what's actually happening inside of the heart in this type of patient? So I mentioned the thickened heart muscle, and this can interfere with normal blood flow. In some patients, this thickening can potentially block or partially block the flow of blood as it's leaving the heart due to that obstruction and that thickness, the wall thickness. And others, it might not block flow directly, but the stiffness, however, can affect how well that heart is going to fill with blood and pump it out into the body, into the vasculature. But either way, these changes can contribute to the symptoms that the patient might experience and the variability in those symptoms. And then this slide might help provide a visual comparison between the healthy heart and one that's affected by HCM. So you'll see on the left a normal healthy heart, and you'll see that the blood flows out of the heart. You're going to have normal blood within the heart and normal thickness of the vessel wall. However, in the HCM heart on the right, you're going to see that thickened heart wall, and that leaves less room for the blood inside of the heart and can also reduce the amount of blood that's pumped out due to that increased wall thickness, depending on how thick it is. And as a result, this heart has to work harder in order to meet the body's demands because it's not able to stretch and fill like a normal heart could, which can lead to symptoms like fatigue, chest discomfort, or rapid heartbeat. And so this is just why people with HCM might look well on the outside if they're not presenting with those symptoms, but they might experience significant limitations in daily life, such as like not being able to bring their groceries in from the car with exertion or walk up a flight of stairs, or they used to go for bike rides and now that's too difficult. So the limitations can definitely vary depending on disease progression and symptom expression. So I mentioned this in the question that was asked, but there's two main types of HCM, obstructive and non-obstructive. In an obstructive HCM, you're going to have that thickened muscle, which is going to block or reduce the blood flow that's leaving the heart. And then in non-obstructive, the heart muscle is still thickened, but it's not going to directly block the flow. So not having that obstruction, not blocking that flow. However, both types can cause symptoms, but however, the underlying mechanisms might be a little bit different, just how the patient is presenting, but it can influence how they are managed. So one key takeaway, if I could express this to this group, is that delayed or misdiagnosed diagnosis of HCM can increase the risk of complications, which is absolutely important. To be able to recognize those symptoms early, being able to talk to your doctor and getting the appropriate evaluation is so important in helping patients manage the condition and in reducing the associated risks with this disease state, especially long term. So in talking about HCM and the serious complications that are associated, these can include heart failure, atrial fibrillation, which is often, which is an irregular heart rhythm. I'm sure, as you guys know, you can have ventricular arrhythmias and stroke. However, not every patient is going to experience these complications, but they are just important to be aware of, and the percentages of the risks associated that you'll see on the bottom. And this is just another reason why making sure you're having those conversations with your providers and having ongoing follow-up with a healthcare provider is so important for patients with HCM to minimize any complications or risks. Hypertrophic cardiomyopathy is considered a common inherited condition, which means that in some cases it can run in families. So if a parent has a diagnosis of HCM, it might be good to have the children evaluated and have that genetic testing early on. And here's a patient quote that highlights how family history can prompt someone to seek evaluation, which can be very important in the identification of the condition early on. And because HCM can be inherited, The genetic testing or family screening I mentioned is often an important part of care. So if someone is diagnosed with HCM, their doctor might recommend that a close family member might be evaluated. It's also important to share any history of sudden cardiac events in the family, as it can help direct care decisions from a provider standpoint for the patient and additional family members. HCM can have a meaningful impact on daily life. I mentioned, limitations with carrying your groceries, going for a bike ride or a walk. So some patients might need to adjust their physical activity if they do experience that fatigue or find that symptoms do limit their ability to perform certain tasks. It can also affect their emotional well-being, including sleep and social activities. So it's important important for patients to communicate these experiences with their healthcare provider, especially if things are changing for them, so that they can be appropriately supported. And while HCM cannot currently be cured, there are treatment approaches that can help manage the symptoms and reduce the risks. And these may include medications or procedures depending on the individual patient. Treatment decisions are personalized, of course. As I mentioned, the variability in how patients can present and what the symptoms that they're going to experience. So it's important for patients to work closely with their healthcare team. And it's also very helpful for family members to be aware of the diagnosis, given the potential genetic component that we've talked about. There are also a number of resources available for patients and families. These include educational materials, advocacy groups, shout out to Juliet on the call, and support services that can provide additional guidance and help patients navigate conversations with their healthcare providers. So if this is something you might be interested in, this slide will provide information on how to access those resources, and I'll also share some resources in the chat as soon as I finish this presentation here in a moment. For you to access and read up more on or share with a family member if you think they might have this condition, and encourage them to talk to their doctor. But just to summarize, HCM is a relatively common but often underdiagnosed condition that affects how the heart functions. And while it can be serious, being able to understand the condition and working with your healthcare provider can certainly help patients manage this condition effectively. So with that, I thank you for your attention. I know this has been a long call for everyone with two presenters, but if there's any general questions, I'm happy to answer them and take those.
Hey, Christian, you may have touched on this, but Rufus was asking about the number of patients worldwide. And then I wanted to ask a question on top of that. Are there, with some conditions, certain ethnic groups are more prone to a certain condition? Is that true with HCM? So two questions in one.
Those are great questions. I don't have the number off the top of my head from this specific deck, but can certainly answer your question privately if you want to provide your email or a way of contact. And then the second question, racial or ethnic backgrounds. I'm not sure of that either off the top of my head. Okay. But I would encourage you to talk to your doctors and just see if it's something you could explore more with them.
Yeah, thank you. And Rufus, we'll make a note of that so that Christian can email you directly afterwards.
Juliet, 1 in 200 to 500 still would be for all races or in all races.
Okay, so across the board, different countries and cultures. Okay, thank you guys. Amy, good question. How, if it's not genetic, how does HCM develop in people? Like what's the reasoning?
Great question. Often, with the evolution of the heart over time and as patients get older, and the heart, if you have, sorry if someone was talking, disease progression and seeing that thickness of the heart wall will definitely attribute, especially to those risk factors that we talked about, like atrial fibrillation.
Could everyone just make sure they're on mute? Thanks. Go ahead, Christian.
Sorry, I lost my train of thought. So we were talking about
Yeah, just the
disease
reasoning for the heart wall thickening.
Oh, right. And like I like to think of it as a rubber band, right? So when you have a young, healthy heart, your rubber band is working normally. You pull it, an elastic, it comes right back. Over time, with a heart that's working harder, whether it's in a disease state that's not diagnosed, like potentially could be HCM, your rubber band's going to start stretching more, working harder to fill and pump that blood effectively out, and you're going to have progression of that thickness of the heart wall, and you're eventually like your rubber band might give out. Right. So thinking of it that way, especially with disease progression, especially as patients are getting older. But with the underdiagnosis piece, I think comes into play here a little bit too. If it's, goes for 5-10 years that you might be experiencing these symptoms, but might not translate them to your doctor, or it potentially could be worked up as something else. So it's important to be very, very honest and transparent with your doctor if things are starting to change, even if you are like having trouble carrying your groceries from the car. And even if it's something like that, expressing that to your doctor so they can potentially work up for the diagnosis.
Thank you. Oh, yeah. And Amy adds, is this the same condition that young athletes develop?
Potentially. Yes, it's definitely important for screening with young athletes, football players out in extreme heat, exerting that force on their heart. Absolutely. So again, always, if you've had a parent that has that sudden cardiac arrest that we talked about earlier, being, communicating that with your healthcare provider that there has been a loss in the family due to those reasonings when you're going for a sports physical, for example, as a young athlete, and having those conversations just to have a little closer look just in case.
We were just talking about this today, Karen and I, about, when you have that diagnosis in your family, the importance of really making sure the young adult population conveys it to their doctor. Like if they're having an issue with their heart, to make sure that the doctor knows about their family heart history, how important that is.
Absolutely.
And then, so Kirk is asking just for a little bit more clarification around what HCM, what it is. So is it the thickening of the heart muscle, or is it a symptom of HCM? I guess explaining a little bit more about what HCM itself is rather than just the thickening.
Right. So hypertrophic cardiomyopathy, hypertrophic is going to be that thickening of the wall. I mentioned the two types. So you have obstructive and non-obstructive. So depending on, how when a doctor goes, it potentially does an echo, for example, with one of the workups. If they're measuring the wall thickness, if they're measuring your ejection fraction, things like that, will help them better understand what type of HCM that you have. If that helps. But generally, you're going to see a few types but a few markers. But again, this is why it's so important to talk to your doctor, and they can do a full workup to be able to test that.
Okay.
Let me try and find the chat.
I have a quick question, if I can hop in. Christian, I'm just wondering, thank you for all the information. Super thought-provoking. So HCM is a diagnosis that stays with you the rest of your life, or can you recover from it? Can you get your heart back to a more healthy, normal state?
Great question. Typically, once the progression is there, especially that hypertrophy, that wall thickness, it's difficult to come back from that and have a fix. There are certainly procedures that can be done, medication therapies that are now on the market. So certainly things that can help alleviate the symptoms, alleviate the progression of the disease, potentially even, the surgical procedures with alleviating some of that thickness, and obstruction. But again, this all comes back to talking to your doctor about it, see what's available to you in terms of therapy, in that regard and what can help.
Thank you.
And I popped into the chat just some resources of, English and Spanish versions. Can it be HCM? If you think this is something that you'd like to talk to your doctor about, like more of a discussion guide that you could share with them, and looking more into those symptoms to better identify if it's something that you or a family member might be experiencing, or a friend.
And Ken was asking about what types of procedures or medicines, and I know you're probably not able to talk about that, but I could just say that there are a couple of therapies on the market right now, Ken. Myosin inhibitors to not cure, like Christian said, but to manage the condition. But then there's also myectomies, right, which is a very invasive way of kind of shaving down that thickened heart muscle. And so that was kind of the more extreme condition, right, Christian, up until some of these treatments came onto the market.
That was the only therapy available until CMIs came on the market. I wish I could talk to you guys more about all of this because it's something I'm certainly passionate about, but I can't. I'm not permitted to answer questions about Camzyos at this time in this forum, but happy to provide the Camzyos prescribing information if you'd be interested, and encourage you to speak with your healthcare provider to learn more about the therapies, whether it was a medication or one of the procedures.
Yeah. And we also, in addition to what Christian shared, we have a plethora of HCM materials on our website too. You guys can go to. But yeah, any other questions? That's okay, guys. We understand.
Like, every question, I'm like, what can I say? What can't I say? I apologize for some of the vagueness.
Well, Christian, I think if anything, you've given us all, you planted a seed so that we can go do our own research. And as you said, we can talk to our own physicians. So I think you've done a great job. Thank you so much.
No, thank you all for having me. I really appreciate it. It was a great group with great questions and insightful questions at that. Very smart bunch here.
Yeah, we do have educated leaders and visitors and members. So yeah, and Lisa,
hopefully these resources will help you if you have friends or you meet someone to be able to share the knowledge in the space, since it is an underdiagnosed disease state, and help them help bring more awareness to this and help prevent it.
I have one more quick question. Are you seeing more and more HCM diagnoses, and is that just because of awareness of the condition, or do you think people are that much sicker, I guess is my question.
Such a great question. I don't know if it's because patients are more sicker, but I think the increased awareness, especially with more therapies on the market than surgical procedures, more options for patients. It's not just one, there's multiple out there now, just to have options for patients. And now it's really bringing awareness, the spread of education in either patient advocacy forums, speaker programs across the country to just shed light to not only provider to provider, but to the community, and events such as that to bring more awareness to this disease state and help slow the progression, might not necessarily stop, but slow the progression and being able to diagnose earlier with that knowledge.
Thank you, Christian. Well, we are so grateful for you being on. Thank you for taking the time. And thank you to our leaders for taking this time out of your day. We hope you found it informative. We'll be putting it online so that if your fellow leaders and board members want to listen, they may do so. And we've got, like I said, some leadership update calls coming up starting Thursday. I'll be sending out those links, and a fabulous webinar coming up tomorrow featuring the Heart Sisters, who have a powerful story to tell about the importance of prevention. So join us for that. Thanks for being on, guys. Have a wonderful night, and we'll see you soon.
Thanks, Mandy. Thanks, Karen.
Thanks, Christian. Thanks, Mandy. Thanks, Heather.
Bye, guys.
Or Mandy.